Now let's speak to the CEO of the National Health Insurance Authority, Dr. Da Costa Boaje. Thank you for your time here on Newsdesk. I also have Professor Gordon Abeka Nkrumah, his Senior Lecturer, Public Administration and Health Service Management at the University of Ghana Business School. I'll start with you, Dr. Da Costa Boaje, because you are at the helm of affairs. How difficult is it when it comes to the number of patients we receive annually that are struggling with NCDs?
Thank you. Let me extend greetings to your listeners. I think from the NHIS perspective, we do fund diabetes and some of the NCDs. But I think what to me is the missing link is the approach that we have used over many years. So if you look at our healthcare architecture, it has actually been focusing on curative. And I think it's now time to introduce the preventive measures in such a way that it will contribute to addressing some of these NCDs. And I mean, looking at the video, it is really pathetic that preventable diseases are now a major cost burden on families and the nation. So I think we must actually look at addressing some of these NCDs from the basis when we introduce preventive healthcare as part of our healthcare architecture. So from the National Health Insurance, I think from next month or even this month, from July, we will be starting an annual health check model when blood sugar, blood pressure, and weight will actually be introduced as part of our benefit package. There is a committee that is chaired by Dr. Nafiba with all the experts on the table to see how we can finance the preventive aspect of these non-communicables, as obviously we believe that is the next pandemic and we must tackle it to reduce our healthcare cost burden.
How much is going to be going into this project?
In fact, it's now been costed, so I wouldn't really be able to tell you because from curative. But we believe that healthcare is not only curative care, preventive healthcare is also. So preventive healthcare should be part of our healthcare delivery system. So we are working on it, and the details will actually come out. All the experts are on the table, I can assure you with that.
Dr. Da Costa, stay with me because I'll be coming back to you because of the new initiative that you put in place that has taken effect, which is helping the vulnerable in society with the cost of dialysis treatment. We'll get into that shortly, but let me bring in Professor Gordon Abeka Nkrumah, Senior Lecturer, Public Administration and Health Service Management at the University of Business School. Now, this NCDs is a silent epidemic, as Dr. Da Costa Boaje has said, but then we're looking at preventive measures. What should we do?
Thank you very much, and good morning once again to your listeners. So I think this morning we had some conversation on this, and I think that the preventive measures are the way to go. And I remember saying on radio that oftentimes when we talk about NCDs, we're basically putting the burden on the health sector or the Ministry of Health and the NHIA, the one that Dr. Aboaje heads. But I think that's only part of the conversation. This is a national issue. It's not just an NHIA issue or Ministry of Health issue. And this morning, I decided to segment the people at risk into three. We have those who are adult and young people who currently have the disease. And then we have those in the middle who may be adult and children who have higher risk factors or predisposed. And then we have the much younger children who are in school. And for me, even those who are in school are the most important ones at the moment. We need to deal with that segment. And how do we deal with that? I would imagine that a two-pronged approach would be important because NCDs are basically lifestyle and then nutrition. So for those who are in school, I would imagine we introducing NCD promotion and preventive measures in the school curriculum so that kids in school can be taught and they would understand the importance of making sure they stick to better lifestyles and better feeding. And for instance, those in school, the rich kids are the ones feeding on all these junks. Education at that level can help us. And for those who come from poor homes, and because of that, their nutrition is bad and their systems are becoming, are adapting to being predisposed to NCDs, things like the school feeding can be strengthened to ensure that we take care of those ones. And then for those at the middle who have a higher predisposition, we talked about feeding. So if it is feeding, access to vegetables in Ghana is not easy. And even when you have access, the quality is also questioned. I believe that the Ministry of Agri can handle this issue by ensuring there is, for instance, a module on the planting for food and jobs, which focuses on house gardening. And at that level, people can actually be encouraged to do household gardening so that they can have access to good quality vegetables and that which is affordable. And then those who already have the disease, that is where Dr. Da Costa comes in. And I think that his focus is something that should be applauded in terms of making sure that we are now even moving NHIA funds to focus on our prevention, what the former Director General used to call adult weighing. And so for me, I think if we move on these tangents, we can be dealing with the issues at all angles. And that will be my initial comments.
You made mention that NCDs is probably a lifestyle disease. Now, in these economic times where people are struggling to afford 3 square meals, how do you manage your finances and ensure you're eating healthy?
Yes, so it's a lifestyle disease. Whatever it is the fact that regardless of the economic situation, we all eat. The issue is about what you eat and not whether we eat or we don't eat. We all eat. So whatever it is that we are eating, the content of it is important. Other things like exercise doesn't cost much. It's about going to work. Now, these days, I live on the university campus, and morning, evening, I find droves walking around. So sometimes we like to give excuses because of the economic condition, which I admit is hard, but we still eat anyway. And we're saying that we need to be a bit diligent and be careful about what we eat. Because if we don't do that, the cost of treating the disease, this morning you heard me in terms of what I was saying, in terms of, for instance, if you take hypertension right now, the direct cost per month on the system is about between 4.3 to about $5.7 million, okay, a month. And that's a lot. And this is just what the individual patient are spending, okay, before you come to what the government is paying. Remember, in Ghana, healthcare is heavily subsidized. So all that cost is not part of it. And so I think that if we can do it now, we save ourselves, okay, the catastrophe of having to pay this. For instance, if you take somebody with hypertension and chronic kidney disease, and of course, if you look at complications that comes with hypertension, chronic kidney disease is key. And it costs an average of around 4,832 Ghana cedis a month. That is directly on the individual. I'll ask you, how much is the average daily wage? And if you multiply it, how many in Ghana gets 4,800? And if you have to allocate that to treatment, it makes a lot of sense to say we sacrifice a bit in terms of being careful with what we eat and doing the exercise, which I think doesn't cost us anything. All that it costs is time and a bit of walking.
I'm just thinking, if I'm having to choose between buying kenke, which costs 4 to 5 cedis, and then buying mangoes, which costs 10 cedis, what decision would I be forced to make as a result of my pocket? And that's where the concern is. Is there alternatives that we could look at?
All right, thank you very much. So once again, I say we have no excuse to defer the choices that we make today to rack up huge costs. I'll give you a simple example. I can afford to buy vegetables from the market. But this morning I was telling Kojo that if you come to my backyard, you see this dispensing bottle that is used in the offices, the big ones that they put on dispensers. I believe that Dr. Da Costa has one in front of his office. All I've done is that I've gone for some of them and I've just slashed the top. And I've just put soil in it and gone for chicken droppings. And I am planting lettuce. I am planting okra, okay? This is something that doesn't cost much because I'm careful about the lettuce that I buy from the market, which I am not too sure how it is planted, the amount of chemicals they put on it. So yes, I hear what you are saying. Mangoes are expensive. But the point is that we need to encourage people that there are cheaper alternatives. There are people who can sit by the, what do you call it? That game, is it dummy? I don't know the English name for that one. What is? Drafts. Yes, they call it draft. People can sit on draft for hours. Some of those hours can be invested into household gardening. And I think that these are life choices that we make. We are not going to get to any point where you would have access to everything you need. But in life, we make choices. It's trade-offs. And we need to encourage people that it's your own life. And it also brings cost to your family. It brings cost to the state. Think about somebody who has diabetes, and because of that, now they are incapacitated. It is not just you, it is your children and your children's children. And so if you are not careful, you're going to be having what I call intergenerational transmission of deprivation. Because you are poor and you cannot do much, your children are likely to be poor and your children's children are likely to be poor. And so we need to think about these things and let it inform the choices we make.
Thank you so much, Professor Gordon Abeka Nkrumah. Now, let me bring in Dr. Da Costa Boaje, because you are at the receiving end most often than not when the financial burden on the patients leads them to having some of these diseases. The NHIS then has to step in to help shoulder the cost. Now, the concern now is about educating the public. We have to do a lot of sensitization. What's your target audience in terms of the sensitization, and how soon will you be rolling it out?
Okay, thank you so much. So I think, you are right to say that we are the financier, but when it comes to the education, actually it falls on the Ghana Health Service and the other institutions, you see. So we need an all-society approach. You know, Prof made a very important point where the responsibility is not on the health service. The responsibility in terms of education and the choices we make is on all Ghanaians, and also it's also on the various institutions. Like, for example, we're doing what we call planting for food and jobs. You see, how can we make sure that we plant vegetables, we plant these fruits in such a way that it becomes cheaper for the population? You see, so how can the Ministry of Agri actually make sure that they reduce, obviously they focus on these vegetables and fruits? When you come to the other sectors, what is their contribution in reducing these NCDs? So, for example, I also know from the health sector point of view, there is something that we call One Health. The One Health approach actually talks about reducing the intake of, for example, meats. So how can we as a nation have what we call like meatless day, or maybe meatless Monday, for example? See, those are the lifestyle choices that Prof is talking about that's going to help. Because for NHI, we are the financier, but we don't really want to wait for people to get sick before we start to pay. We want to reduce our cost burden. So we are saying that our healthcare system cannot continue to be on curative. Preventive healthcare should be introduced. And there is also what we call the network of practice being championed by the Ghana Health Service. Under that, there is a model of education and some community engagement that is being piloted within for us to see the real cost, so that we will look at it from the NHIS point of view, whether it can't obviously be onboarded. But we don't just add stuff to our package. We really want to learn from it and look at the implications in terms of the sustainability of the scheme. So I think the whole society approach is what is going to help us. And I think we should take the advice of Prof and all the other stakeholders very serious in reducing these NCDs.
Stay.